So at this year's ASH meeting in 2023, we presented an update of our study, our frontline study of Cladribine plus low-dose Cytarabine combined with Venetoclax, alternating with AZA and Ven in patients with newly diagnosed AML who are aged 60 years of age or older. The whole concept of this is to develop a new lower intensity backbone that is active, potentially more active than just HMA or low-dose Cytarabine alone in combination with Venetoclax. We've been using this backbone for years, and we recently combined it in a phase 2 study and published it in combination with Venetoclax. The recent update at this meeting includes 123 patients with newly diagnosed AML with a median age of 68 years. The overall response rate includes CR, CRI, was 75% of CR and 13% CRI, for a total response rate of 85%. Among those patients who achieved over CR or CRI, 78% were MRD negative by flow cytometry. We saw that the response rate was equal or relatively similar across ELN subgroups, with a similar overall survival by ELN 2022. As an additional caveat, we noted that among patients with HMA-Ven, there was potentially less benefit among those patients treated with HMA-Ven who had mutations in RAS or who were monocytic. And so in this particular analysis, we actually looked at subsets by the ELN, but also by the donor classification of the molecular prognostic risk scoring system, where we looked at patients who had RAS mutations, FLT3 mutations, P53 mutations, as well as none of those mutations. And we found that even among those patients who had RAS mutations, where the benefit was not as striking with HMA-Ven, we saw benefit in terms of survival in patients treated with Cladribine LDAC Venetoclax on this study. Additionally, among those patients with P53 mutations, we saw a response rate over 60% and a median survival that was not reached in among 15 patients with P53 mutated AML, which, although early, represents a very exciting and early encouraging results in this very difficult population. So the long-term survival in this median survival was 50 months in this older population, and the cumulative incidence of relapse without death were 22 and 16% respectively.